Welcome to this segment of our learning series on Health Equity Basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. This segment will review some of the actions that individuals and organizations might take to help advance health equity. Everyone has a role to play in advancing health equity. There is work to be done at all levels. Even small changes can contribute to advancing health equity. As a community member or member of an organization, we can join the effort to advance health equity. First of all, know our rights. There are laws against discrimination. We can work to become aware of our biases and notice microaggressive behaviors either we contribute to or happen around us. We can practice the cultural humility humble model to support our work and be aware of and support diversity, equity, and inclusion programs where we work and in our community. We can help support the organizations that are currently working on health equity, and we can engage in lifelong learning and help create a safe space for discussions about culture, bias, diversity, and inclusion in our life and workplace. Organizations can work to recognize, respect, and support the diversity of the community we serve. We can use clear and culturally relevant information that is suitable for diverse audiences, train all of our employees to identify and interrupt all forms of discrimination, and provide them with training in implicit bias. We can deliver services in a culturally appropriate way and build partnerships with different industry sectors and community members to look at developing upstream solutions and collaborate to advance health equity. As healthcare organizations, we can establish a commitment to health equity and adopt an upstream approach. We can create cultural and equitable patient education materials and implement screening tools to help determine health-related social needs caused by social determinants of health. We can be aware that quality improvement efforts can unknowingly improve care for one group of patients while worsening it for another. And we can use data sources to help identify gaps in care and opportunities to advance health equity. The topic of health equity is complex, and communicating about it can be challenging. Here are some recommendations from the CDC's Office on Health Equity on creating broader understanding on this topic. We can meet our audience where they are, learn about their beliefs, values, and biases toward health equity topics. We can communicate health equity as a we issue and build on shared values. And we can frame health equity as an achievable goal and provide examples of how everyone can help advance health equity. Advancing health equity will require us to work together to remove barriers so that everyone has a chance to live the healthiest life possible. The last segment will wrap up this learning series and provide information on the resources used to produce this program, as well as some additional resources on the topics covered during this learning series.